What is an endoscopic facelift? A facelift is a procedure where we lift the cheek, jowl, and neck soft tissues. We're trying to reposition them in a position that they were earlier in life to make the face look rejuvenated, to make it look more youthful. We also do that in the forehead and brow area. We call that an endoscopic brow lift. The mere thing of calling it endoscopic suggests that we're using a scope underneath the skin and usually using smaller incisions. The concept of that is a good one, to use smaller incisions. But we have to think, if we're going to move all the tissue, where does it go? Does it just bunch up? Well, that's not necessarily good. So we often have to make the incision large enough that we can redistribute the extra tissue after we've lifted it. In my practice, endoscopic lifts work great in the brow, but only for some people. They work less well down here. They work well in the brow because our dissection plane is on the bone. In the face, there's more soft tissue, so we use less endoscopic facelifts. But we do use endoscopic brow lifts. The potential brow lift patient has to know is endoscopic brow lifts, if done correctly, move the hairline back. So they work great for people who start out with low hairlines, or sometimes even average hairlines, but they're not good at all for people with high hairlines or very long foreheads. In fact, I do the brow lift very differently, not with an endoscope for those people. You recommend an endoscopic facelift. It's like any procedure. It's specific. If the person has lots of excess tissue, an endoscopic lift is likely not going to work very well. And if the surgeon says, I'm doing an endoscopic lift and getting a good result, they're probably making other incisions, and the endoscopic part is a throw-in for marketing. It's really not it's an open procedure. And endoscopic procedures are relatively closed. Small incision, we dissect underneath the skin with that magnifying scope, and then we move the tissue. So we have to have a way to redistribute the extra tissue. And endoscopic surgery works well when we can do that. In the case of this, move the hairline back. Some people can tolerate that, others cannot. When it comes to brow lifts and facelifts, I've done this for 36 years. I consider myself an expert. Call me, email me. I'd love to talk to you about your questions. I help patients like you every day, and I'd love to see you in my office. Thanks a lot for watching.